As the COVID-19 crisis threatens to overwhelm our hospitals and our healthcare system and put more and more pressure on frontline workers, including doctors and nurses, the cry is growing louder to allow medical professionals who have received their training outside of Canada, many of whom live here in Brampton, to let them practice here. Their message is loud and clear. They can and want to help.
We want to work as doctors. We want to help out in the front line.
Give us the opportunity to move forward and see what we can do on the front lines. We're ready to serve.
These Brampton doctors received their training outside of Canada. Both say they have sparkling resumes and credentials. In a news conference today, Mayor Patrick Brown said they are just two of as many as 13,000 foreign-trained doctors and 6,000 foreign-educated nurses in the province that are not licensed to practice in Ontario. Brown says it's time for the province to lift some of the barriers and restrictions that are preventing them from working on the front lines.
Brampton may have more internationally trained physicians in our city than anywhere else in Canada, and they are ready. They are eager to help out in this battle against COVID-19.
Both Mayor Brown and Brampton City Councillor Charmaine Williams have written open letters to Health Minister Christine Elliott. They have also started a petition on the website More Doctors Now. They're asking the government to expedite testing and reduce the cost of it.
In terms of the immediate challenge, it's financial. There's only so much room in the physician budget. That's the number one hurdle that needs to be averted.
And more ever than that, we need to employ the skills that these foreign-trained doctors brought with them to Canada.
For those working in our hospitals, clinics, and assessment centers, my message to our healthcare heroes is this: help is on the way.
Today, the Premier took a step in the right direction, Mayor Brown says, by announcing a new online portal meant to match willing and qualified healthcare workers to facilities where they're needed, which could include foreign-educated doctors, but no promises were made.
They may or may not, depending on their skill sets, their experience, and so on, be able to practice medicine, but they will certainly have a place within our healthcare system. And as the Premier said, we do need all hands on deck.
Brampton officials say it's a terrible waste that qualified, talented healthcare professionals are working in packaging plants or in real estate or as cab drivers instead of doing what they're trained to do and help save lives. Well, the province is issuing temporary 30-day licenses to some internationally trained physicians. They say that does not go far enough.
It's finally time to put the foreign-trained doctors who qualify to work to help keep us healthy and save lives, and not just for 30 days, but for 30 years.
Mayor Patrick Brown also noted today that other jurisdictions have eased their restrictions to allow more foreign-trained doctors and nurses to practice, including in New York and New Jersey, where they have welcomed the help in the battle against this enemy. In Brampton, I'm Pam Seatle, City News.